Hello, everybody, and thanks for joining us for today's webinar titled 5 Best Practices to Practically Eliminate Downtime in Healthcare. I'm Kevin Collins from Unitrends, and I'm here with Dick Sappler, one of our product marketing managers, and he'll be taking us through the presentation. And don't forget, one lucky attendee will be winning a $100 Amazon gift card. We'll contact the winner via email after the webinar. But before we get started, I'd like to cover a few housekeeping items. This session will be recorded, and you'll receive a link with an email to the on-demand version of the webinar. I would also encourage you to ask questions throughout the presentation. You can do so by typing them into the Q&A box in the bottom right of the player. We'll answer your questions at the end of the session. At this point, I'll turn it over to Dick. Enjoy the presentation, and Dick, take it away.
Great. Thanks, Kevin. Hello, everybody. I appreciate you joining me today. Hope not to take too much of your time. As Kevin said, I'm Dick Sappler. I'm the product marketing manager for Unitrends, and today I'm coming to you from rainy, cold, and wet Burlington, Massachusetts. Part of my job is that I'm managing the customer success program. So I talk to many of our customers every week, and several of them every week are healthcare customers, as we have a large number of healthcare customers. So the goal of this webcast is really to give you some insight into the best practices that these customers are following within the healthcare industry. The healthcare industry really is unique. It is very different from any others, and therefore you have unique data, backup, and business continuity challenges. So I really went and kind of boiled down most of the feedback that I've gotten from our healthcare customers into 5 unique challenges that healthcare has that are either different or more difficult and more demanding than other industries. But first, let me introduce you to Unitrends. Unitrends literally has over 1,000 customers within the healthcare industry. And I'm talking hospitals, physicians groups, labs and clinics, and even medical suppliers as demanded by HIPAA. And we'll get into that in greater detail through the presentation. So all of these, the quotes that you see on the slides and the learnings that I'm going to share with you today are included in customer success stories on unitrends.com, our website. So let's get right into the 5 unique challenges of the healthcare industry. Lesson number 1, the uptime requirements. Now, this is probably not news to anyone from the healthcare industry listening in today, but I hear it literally almost every interview, regardless of the role of the IT person within the industry, that uptime requirements are extremely high. So, you know, as you would know, healthcare is literally a life and death industry. Electronic health records are what are called EHRs, are needed at any time and at all times. And if there's a loss due to a server failure, a virus, or an accidental data deletion, recovery times or RTOs need to be measured in seconds or minutes at the most. And according to HIPAA, which is the Health Insurance Portability and Accountability Act, measuring and documenting those recovery times are specific mandates for the industry. So what is it that Unitrends can do to help you? Well, first of all, there are a couple of things that you need to know as a healthcare IT professional. You need to know the exact time of your last successful backup, as that's the data set that you can recover with. And secondly, you need to know that all of the applications, the data, the settings, and the physical hardware are available and ready for you to recover when needed. And this is why recovery testing is so critical. Unitrends has a product called Recovery Assurance that will actually test the ability to recover right up to the point of actually launching an application. And it will also document the time and the results of that test so that you can use this as part of your HIPAA audit. Unitrends also supports what's called instant recovery for failed applications. Both of our hardware and software virtual appliances can act as a recovery platform from a remote site if needed. So if you lose your primary site, you lose your primary servers, the remote site since it already has the backup software and all of the applications and the settings and so forth, can recover instantly, boot up, and make that application available to you to your customers. And finally, Unitrends has automatic detection of ransomware infection. This is becoming more and more critical as ransomware is becoming a larger and larger industry, and we have a whole section to talk about that later on. But auto detection of ransomware is now a key feature and function. So you need to have 100% confidence in your ability to recover. So as I hinted, lesson number 2, healthcare industry is highly targeted by ransomware. And quite frankly, I don't know any healthcare company that I've talked to that hasn't either been a victim or discovered it in process and was able to do a quick recovery. So let me share a little bit more around that. So as many of you may know, virus scanners are really only for ransomware that's already seen and been detected by security companies, a solution coded, and distributed out to the user base. A virus scanner does nothing for new variants, and literally new variants of ransomware are showing up every day. Now you can try and train your users, and you can train them all you want, but they're going to go where they want. They're going to click on bad files. They're going to be clickbait, and they're going to infect your infrastructure. You will be infected. It's only a matter of time. These ransomware pirates are good, and they're getting better. 60% of organizations report that they were attacked last year, and quite frankly, I think the other 40% are liars. 40% of email spam now contains ransomware links. And in fact, there's a whole industry growing up called ransomware as a service. You can go on YouTube and look for it, and you'll see ransomware criminals hawking their ransomware platform that you can then use to become a ransomware criminal yourself. All you have to do is pay them in Bitcoins. So this is an expanding and growing threat to every healthcare provider. So really, the only response that you have, the only real protection that you have against ransomware is good data backups. And what you do is you roll your systems back to the point just before infection. So that's why it's important to have lots of snapshots. That's your recovery point, your last good backup. So we do have, Unitrends has some unique ransomware recovery capabilities, included automated testing. So we can test the backups to make sure they're not infected and retest the recovery to a point where we know that you can recover and go again. So again, you need to know the exact time of your last good backup. And Unitrends has predictive analytics to be able to identify a ransomware that's actually in effect, an attack. So a lot of ransomware will not even trigger a warning or a screen opened that says you've been infected until they've actually been in there for sometimes up to weeks. And so that gives them more time to go and infect more files and encrypt more backup. So the last point I want to make is that all Unitrends backup appliances are written in hardened Linux. Now, needless to say, most ransomware pirates are going after Windows-based servers because that's the prevalent market. You know, 80% of the servers out there are Windows-based. So if you have a Windows-based backup appliance, it can become part of the ransomware attack. So you need to have an appliance that's written in hardened Linux. Lesson number 3, healthcare industries are really facing a lot of regulations both at the state and the federal level. And so let's go through that a little bit. So clearly the number one set of regulations that you have to deal with is HIPAA, or what's called the Health Insurance Portability and Accountability Act. This is a U.S. law designed to provide privacy standards to protect patients' medical records and health information. And this is applicable to health plans, doctors, hospitals, and other healthcare providers. Now, prior to HIPAA, there was really no generally accepted set of security standards, but HIPAA now has mandated how they should be enacted. So number one, they have to ensure the confidentiality, integrity, and the availability of all personal health information that is created. You need to identify and protect against reasonably anticipated threats to the security, and that would include loss and ransomware attacks. You have to protect against reasonably anticipated impermissible use and disclosures, so hackers coming in and trying to steal the data. And you have to ensure compliance by your workforce. Now, another law called High-Tech Omnibus Rule actually extends the HIPAA requirements to business associates of healthcare institutions, so such as labs, suppliers, and providers of medical services. If they in any way deal with private health information, then they too come under the HIPAA mandates. These are very serious mandates with very serious penalties. So healthcare providers have to meet what's called a HIPAA audit and be able to document that they're meeting all the requirements of HIPAA. Now, Unitrends all-in-one solution can back up and protect anything in your data center. We protect the virtual, the physical, the local, the remote, on-site, and in the cloud. And you can, with our recovery series, you can easily add backup coverage to new backup targets with no additional licensing fees. So simply by adding them, then you add them into the backup pool, and they're covered. So after each backup event, you can choose to receive an email confirming that the backup was successful, and if not, which files were affected, and therefore be able to use that to show in your HIPAA audits that you're compliant. Our recovery assurance tests also include documentations on the RPO and RTO times, and most of our customers use our backup appliances and recovery assurance to show and pass HIPAA audits. Plus, we have built-in AES 256-bit encryption to protect healthcare data both at rest and in flight. And our Unitrends Cloud product, as well as our Office 365 cloud backup appliances, are HIPAA compliant. Lesson number 4, you need to control your proprietary data at all times. So part of the HIPAA mandates requires that you protect your healthcare information and be in your control at all times. The HIPAA security rule has technical safeguards that require technical and the policy and procedures for its use that protects electronic protected health information and control access to it. Therefore, you must know where your physical data is located at all times of the life cycle, as well as control who has access to it. And the security rule, HIPAA, covers a covered entity to use security measures that is reasonable and appropriate. And so it doesn't mandate, HIPAA does not mandate particular types of technologies or particular vendors. It just mandates that you have a plan and security measures in place in order to meet this challenge. So healthcare providers want to keep absolute control of the data. Our appliances, both our hardware and our virtual software appliances, support local, remote data replication to secondary sites and into our HIPAA-compliant clouds, so literally the files stay completely in your control or in Unitrends' control, and that we meet that HIPAA compliance. We have the ability to encrypt selected files in standard Unitrends appliances so that they are encrypted both in flight and at rest if that's what you choose. And we allow literally exabyte scale backups to be managed from a single device and with a single interface, so that you don't have to let large numbers of IT professionals into your backup and your management routines. This way you ensure absolute control of where the backups are located, who has access to the backups, and when those backups are put back into production environments. So Unitrends will sign a HIPAA Business Associate Agreement to show that your cloud, Office 365, and your Unitrends Cloud implementations are HIPAA compliant. So Unitrends can work with you to meet these proprietary data control requirements. And finally, lesson number 5, recover deleted files. This is the #1 most requested IT task from healthcare pros, and I hear this over and over again, that literally this task needs to be performed almost on a daily basis, because healthcare IT professionals support large numbers of fairly unsophisticated users, and I'm talking about nurses, administrators, doctors, and so forth, and also some highly sophisticated users that just do stupid things. You know, they delete files, they lose files, and you also have, disgruntled employees that get laid off. They delete their entire file before they leave, and so those files have to be recovered. So you need to be able to find the individual files, you need to restore them, and the longer this takes, the longer it takes an IT professional out of his normal business routine and has him doing kind of looking back. And if you're using tapes, it's a terribly labor-intensive job to find particular files on a tape device. So with Unitrends, this is actually an area that we shine, and you should be able to restore a deleted file, and I mean from login to full user access in less than 5 minutes. With Unitrends, you have a single user interface that covers all of our products. It's very, very simple to do. Even untrained staff can easily find and restore a file. And you use this same process whether you're restoring a file, a folder, or an individual data set. So the next time you're asked to recover a file, time yourself and see if you can do it in less than 5 minutes, or that all of the members of your IT staff can do it. So those are the 5 key variables or the key areas of how healthcare industry is different from other industries. But let's just review Unitrends' capabilities for a few slides. We are #1 in all-in-one backup and business continuity. We have a all-in-one solution. You look on the left-hand side of this image and you see all of the elements that would be required for a backup and recovery and business continuity solution. And all of those items are included in our Unitrends appliances. It literally is, you rack it, you connect it, and you're ready to go. And during that process, our customer service people are on the phone with you, helping you through the setup process. It comes with cloud integration software. You can use the Unitrends cloud if you wish, or you can go to Amazon or Microsoft Azure if that's your cloud application of choice. It really is extremely simple to do. So really what you want, what healthcare professionals have been looking for and why we have so many healthcare customers, IT professionals don't want to think about backup. Backup is basically keeping them from doing the job that they're really hired to do, which is to make the hospital a better place to work and more efficient. So by having a single supplier for backup and recovery that covers all aspects, there's no finger pointing. There's literally one throat to choke. You call us, and we take care of it. And by the way, our customer service organization has a 98% customer satisfaction rating. Our service reps are based in South Carolina in the same building, on the same floor, in the same office as our engineering and test dev people. So they literally are co-located with the engineering resources they need. So we have less management, very simple UI, more flexibility. You can set backup schedules based on SLAs or based on granular of where you want the backups to go and so forth. And literally what we do is we give you more uptime, more confidence, and more free time to spend on your other IT tasks. So just backup and continuity does not have to be complex. Buy an all-in-one purpose-built appliance and you're halfway there. And the intuitive user interface makes it really easy to set up and go. So basically, in summary, healthcare really is a unique industry, and your requirements are really unusual and different from other industries. We literally have over 1,000 healthcare customers and who have found satisfaction with us. and we have the features to meet the special needs of the healthcare industry. So that concludes my webcast, and let's go back to Kevin.
Thanks, Dick. Great presentation. Just a reminder, if you want to ask a question, you can do so by typing it into the bottom right-hand corner of the player, and we'll get started with the first question here. First question is, can you go into more detail on Unitrends' ability to automatically detect a ransomware attack?
Okay, yeah, I probably should have done this more in the presentation. So what happens is when you take a backup of say, a database, it has a certain footprint. It has a certain, data elements to it. If a ransomware attack happens, what it does is it goes in and encrypts that database. And then your next backup, when you're using deduplication, what you find is that there's very little deduplicated because there's nothing similar between the original backup and the new backup. And so the ransomware affected file also has a certain footprint to it, a certain look and feel. And so our software can automatically detect that this file has changed dramatically from the last backup, and then also see that the look of that file, the new file, has elements of a ransomware attack. So then what will happen is the software will automatically send an email to the administrator saying that this file looks like it's been a victim of ransomware. And that's very important because the sooner you catch a ransomware attack, the less data gets encrypted, and the less data then has to be recovered from a backup, which means your recovery time is faster. So by using our software, you get automatic detection of ransomware attack and then an automatic notification. Okay?
All right. Thank you. Next question is, if we have a remote site with a Unitrends device, do we have to have IT working there?
Okay, and this is also another element of healthcare, is that more and more healthcare businesses are becoming multi-site. As conglomerates buy up and multiple hospitals and start contracting with physicians groups and so forth, the IT group actually starts be responsible for multiple sites, and they can't be everywhere physically. So all of our Unitrends appliances can be managed out of a single device. So you can declare one as the master and then use the interface of that master and manage the devices that are remote, either both virtual, physical, hardware recovery series of hardware appliances, or our software, Unitrends Backup Virtual Appliance. So literally you can manage all the backups, and one single device can literally support up to hundreds of thousands of devices. So you don't have to be everywhere. You can do it all from the home office.
Okay. Next question is, how large and how many sites can be managed by a single device?
Okay, so I started getting into this a little bit, but literally a single device can manage thousands. We've done it up to thousands in the lab, which is is theoretical. No one's going to have thousands and be managed out of it with a single device. You're going to divide up the backup libraries and do that. We do have what's called role-based management, which you can parcel out, so you can make the SQL team responsible for their SQL backups and not give them the ability to manage anybody else's backups. You can give an IT group that's in a physically different location control of their own backups and so forth. So you can kind of parse up the very large pool. But if you choose to manage as a single pool, we can literally get to exabytes in size. And we don't have any customers that are quite at that scale, but we do have some large enterprises that have very, very large libraries that we can manage.
Okay. Looks like we've got one more question, and then we'll wrap it up. The question is, I've heard a lot about the 3-2-1 rule of backups. Can you go a little bit more into detail about that?
Yeah, sometimes this is called the grandfather, father, child rule too. So you want 3 different copies of your backups. You want them on 2 different media types, and you want one copy that's at a very remote location, completely disconnected from from your production environment. So the 3 different backups, that's the grandfather, father, child rule, so that you can go back in time as on each of those files. You want 2 different media types, generally, disk, and now cloud is becoming very popular. And you want one physically remote. And what we've heard about lately is a form of ransomware that actually goes in and looks for backup files and deletes them. That's particularly nasty. You want to be able to get one set of your backups completely away and unconnected so that if you do get hit with a ransomware attack, that those backup files are safe and can be used for recovery.
All right. Thanks so much. Looks like we'll wrap it up just in time here. As a reminder, this webinar was recorded, and you'll receive a link with the on-demand version within a day or so. And we'll also contact the winner of the $100 Amazon gift card via email later this afternoon, and it'll also be announced in the follow-up email. Thanks for joining us today, and we look forward to having you on future webinars. Take care, everybody.
Thank you. Bye-bye.